worst among many bad chapters in political and media commentary. But the president wasn't wrong about the power of, quote, disinfectants in many ways in the body. We can announce tonight the advent of a potential treatment from the Houston-based company Pulmotect that harnesses the ability of the lungs to generate superoxides. Dr. Burton Dickey, a founder and shareholder of Pulmotect, has been researching this for 2 decades in his lab at MD Anderson Cancer Center in Houston. And he says that the drug lands on the surface of the epithelial cells in the lung and signals them to produce superoxide and peroxide for several days, similar to the way bleach kills germs on a kitchen table. Superoxide and peroxide in the lungs rapidly kills germs that are inhaled. 2 of the men working with Dr. Dickey with him to bring this drug to market are here with us tonight. Joining me exclusively, Dr. Colin Broome, physician and scientist and CEO of Pulmotect. Also with me is Leo Lindbeck, chairman of the board of the company. Dr. Broome, let me start with you. Explain for our audience, if this works out in the clinical trials, how this drug would be administered.
So PUL42 is a drug. It's a combination of 2 molecules that's administered by inhalation. So it's an inhalation therapy that goes straight down into the lungs. And as you referred to, when it lands on the lung surface, it stimulates and signals the epithelium to be aware and start producing a noxious chemical barrier. This is natural. This is evolution. This is what we call innate immunity, which you referred to earlier on. And what we intend to do here is to run 2 clinical trials, one to prevent infection, and the other to treat early infection with patients with COVID-19.
Well, Leo, if this has been around for a while, I mean, this general understanding of how this would, quote, disinfect the lungs, could this have been something the president had heard about or was even briefed on or generally understood?
You know, I don't know, Laura. I guess have to ask him that. But, this notion of using superoxides to kill pathogens, I mean, that goes back. My mom talked about using disinfectants. But, of course, you wouldn't breathe this stuff in. Nature's evolved this really exquisite mechanism for getting your lungs to secrete superoxide at the time that they need them. And what we've been able to do, and Dr. Dickey's lab and Dr. Scott Evans and some of the other folks who helped develop this, we've been able to figure out how to stimulate that so that we can sort of turn on your innate immunity and put it on high alert. This is your frontline defense. And by doing that, we can prevent the infection in the lungs. And that's the game, right? The game here is to stop pneumonia. Pneumonia is what kills people. And if we can stop that, then this turns into a very different kind of virus.
Yeah, and while a lot of people are focusing on the vaccines, doctors, I mean, those could be, we don't even know if we have a vaccine. A lot of vaccines end up doing harm to people. They help people in many cases, but they also, we know the story of what happened with the swine flu, never got an HIV vaccine. So this could be a treatment, again, if it works, a treatment that changes the way we even think about this. Correct, Dr. Broome?
Yes, indeed. And the studies that we're planning to do, which we intend to start dosing next week, are very well-controlled studies. And, of course, we have to look at not just the potential positive effect, but also for drugs for safety. So these well-controlled studies, we hope to execute them very quickly and be in a position where then we could do potentially larger studies and potentially have a treatment available before year end.
And Leo, there a lot of people are saying, and another individual just said, Dr. Jorge Rodriguez earlier today on CNN, he basically says, we don't have any immunity to this. He claims that that COVID is like, he equated it to smallpox, which obviously was incredibly deadly. But we do have innate immunity, and we have to make sure we can trigger it if possible, and that's what you're trying to do here, correct?
That's correct. We really have 2 immune systems. We have an innate immune system and an adaptive immune system. A lot of the attention is focused on vaccines and antibodies, and those really leverage the adaptive immune system. We're focused on the innate immune system, and and stimulating that. And what's really exciting about the innate immune system is it is not specific to a pathogen. So if we can figure out a way to unlock and harness the power of the innate immune system, then not only can we protect against COVID, but future emerging pathogens could also be responsive to the same treatment.
Well, I look forward to seeing what happens with your studies, and I think